Good evening, everyone, and welcome to the Advocata Institute's Twitter space on Sri Lanka's COVID response. What is the role of the private sector? Today, we have learned that the Delta variant that has ravaged our neighbor India is now in Sri Lanka, with the possibility of community transmission. Sri Lanka has been grappling with COVID-19 for over a year now, and at present we are facing a third wave, with travel restrictions, rising cases, and concerns about hospital capacity. Now more than ever, we need to be utilizing all the resources that are available to manage this crisis and reduce the human toll that it is taking. We have with us today 3 experts to discuss this very topic. So without further ado, let me introduce our speakers for today. We have with us Dr. Ravindra, Rannan-Eliya, the Executive Director and Fellow of the Institute of Health Policy. He has expertise in health systems equity, health financing and policy, and public expenditure. He is a leading international expert in health expenditure estimation and projection and in health account systems, and has collaborated extensively with the WHO, the World Bank, and the OECD. Dr. Lakith Peiris is the president of the Association of Private Hospitals and Nursing Homes and is the managing director of Hemas Hospital and a laboratory chain. He is a well-known leader in the healthcare industry with over 20 years of experience in healthcare-related MNCs and Sri Lankan enterprises. And last but definitely not least, we have with us Mr. Shyam Sathasivam, an executive director at Sunshine Holdings PLC, a listed conglomerate. A graduate of the London School of Economics, he is responsible for the consumer and healthcare sectors of the group and brings to the table extensive experience. To start off today's discussion, Dr. Lakith, could you start us off by telling us a little bit about what the private sector has done so far? Like, what has their role been so far in combating and addressing the pandemic?
Ayubowan, everyone. And first of all, let me thank Advocata for inviting me, and also my appreciation to Dr. Rannan-Eliya and Shyam and Anita. So Anita, COVID-19 pandemic has really impacted our lifestyles. It is life-threatening. Livelihoods of people are being impacted, and also most of the corporates and their employees are being impacted negatively. And the hospital industry in particular was impacted due to the decline in revenues and increased cost and so on. But where the private sector is concerned, the private hospitals industry came together as one. We were quite agile, extremely responsive in quickly to provide safe, top quality healthcare services, and took stringent measures to mitigate all risks as much as possible. And by putting into action well thought out protocols that were also shared by the Ministry of Health, the Epidemiology Unit, the WHO, and also with experts in the field of infectious diseases, to protect and safeguard the doctors, the caregivers, the healthcare workers, the staff, patients, and the community, and everyone who would walk through hospital doors. And we also put in place a very robust governance structure comprising of steering committees to assess the country's situation, new development on a daily basis. We engage with all stakeholders such as the National Operations Center for Prevention of COVID-19 Outbreak, Epidemiology Unit, MOH, the Private Hospitals Association itself. And like I said earlier, we were quite agile and quick to respond to new needs for the convenience and the safety of people of Sri Lanka. So in order to help and support the government of Sri Lanka in the battle against COVID-19, we were very quick to put up new PCR labs. Dr. Rannan-Eliya will tell us that, he has been advocating more and more testing in Sri Lanka, so we were able to increase the capacity. So like I said, we put up PCR testing facilities, and then we also supported the government in putting up intermediate care centers for COVID-19 treatment, adding capacity to the bed strength of the country. Then also introduced new things, new areas such as home care services, telemedicines, and also hospitals like bigger hospitals. They put up fully fledged ICU facilities to also increase the ICU bed capacity. So these are some of the things in brief that we have done, but I can go on during the discussion.
Thank you, Dr. Lakith. So you mentioned the role that the private sector has played in increasing testing. Dr. Rannan-Eliya, could you jump in on that and give us your thoughts on the role the private sector has in this particular capacity, and also what we can learn from the international experience of how other countries have handled the pandemic, and in particular, what role the private sector has had in doing so?
Sure. No, I think the private sector on the whole has done what it can. I think that they made a significant contribution, not only, I think, to increasing testing capacity, but I think the other thing that some of us were well aware of was that they showed how existing capacity could be used more efficiently. So, I mean, I think there's clearly a case that the Ministry of Health could improve output even with its existing facilities if it ran them, let's say, more efficiently and more extensively. So I think that's been a major contribution. I think that, I'm not sure whether Dr. Lakith mentioned, because I missed the early part of what he was saying, but I think at the moment we could probably do with more contribution from the private sector, but I suspect it's not a private sector decision to make. I think that there's a policy constraint on allowing the private sector to contribute more. And then overall, globally, countries who tested more earlier in the process as well have done much better in controlling the spread of the virus. We have shown in our own research, and globally the evidence is very clear, that PCR testing is the most effective intervention, the most cost-effective intervention to control this pandemic. So I'm grateful for the private sector, but I think it's more a public policy problem more than the private sector's inability to contribute more.
Thank you, Dr. Rannan-Eliya. So while you emphasize the importance of testing and PCR testing in particular, Sri Lanka has been having a fairly, how do we put it, sort of limited vaccine response, shall we say. We've seen waves of vaccines being available, different varieties in different ways as well. What do you think Sri Lanka needs to do in order to amp up its vaccine procurement and distribution? And I'd like Mr. Sathasivam to also jump in on this question. But in your opinion, should we be focusing on PCR testing or should we be focusing on vaccines?
So I think both are necessary, but I think we need to be realistic. Even if we had an effective vaccine procurement program, it's going to take till the end of the year to fully vaccinate most people. So during that time, literally hundreds, thousands of people could die if we don't control the virus. So the short-term priority has been, for more than a year, we have to control the virus spread, try and aim to get down to zero, because we don't want to have these things like the Delta variant causing havoc, which I think it will do. And in the meantime, we need to ramp up vaccination so that we can protect the population against new outbreaks. And I think that should be the plan. So I think both are needed. But in the short run, vaccination cannot prevent people dying, and it cannot prevent tens of thousands, hundreds of thousands of people getting infected. The short-term defense has to be testing. And then after vaccination is achieved, I think if you look at the countries who are thinking further ahead, like Singapore, New Zealand, Australia, these countries realize that they're going to combine vaccination and testing long term. So as the Singaporean Prime Minister recently said, they will vaccinate everyone, but then they will have some kind of border security, and every time they have an outbreak, they're going to use test and trace to basically crush it out. So I think that has to be the long-term strategy.
And Mr. Shyam, could you be able to jump in on that? And especially on vaccine procurement, does the private sector have a role to play there?
Thanks. I think so. Primarily, the private sector was the largest player in vaccine procurement till COVID hit. And then overnight, I guess, across the world, just given the scale of it, all governments jumped in. But the context is in terms of from tracking, from when it was announced, in terms of what products were going to be coming to the market, and sort of understanding the supply chain dynamics of, ordering multiple, ordering on time. Lots of dynamics, right? And I think the government sector managed, but definitely a partnership with the private sector, in my personal belief, I think would have had better results. But at this point in time, I think we all just need to rally together and make as much product available. I think more and more vaccines will come through. I was just looking at who else is stuck like us. It seems like Nepal and Bangladesh are also sort of short of the AstraZeneca at this point in time. So while it's painful for us, this is not an unusual phenomenon right now, given what's happening across the world. The private sector, of course, is firstly the producer across the world, right? So in terms of, and we've been procuring these products in terms of across countries for multiple years now. So what we need to, I think, quickly get to is, we're in stage one where we're looking at initial, so it's very much government to government, but let's start getting ready for, once this sort of the next 3 months dies down, I think you will see more supply come into the market. Right? and in that context. The same issue will be there for testing. I mean, molecular biology or the PCR sort of project wasn't a large field till, COVID hit. And now overnight, everybody is scrambling to sort of put testing in place. For example, Germany does 58,000 tests a day, of which 50% are by the private sector. And either insurance or the government covers it. So I think it's that sort of approach where we need to sort of corral everybody around, participate in it, whether it's testing, treatment, or vaccination across all three areas. The private sector has a large role to participate in order to increase capacity. And as well as for solutions, we are evolving. Dr. Rannan-Eliya spoke about the Delta variant. That is something of significance that's now it's in Sri Lanka. So we've got to figure out what are we going to do about treatment, right, or prevention in the first instance, right? What do we need to sort of participate in that area? Testing between rapid tests, PCRs. There's been a whole slew of products that we need to engage with, and yes, some of the product may not work as well, and we need to quickly move on. So I think it's in that context, this constant change, that dealing with the dynamics that's happening, and that's, I think, really an area where the private sector can excel at.
Thank you, Mr. Sathasivam. Dr. Rannan-Eliya, if I could pose the next question to you. I believe you mentioned on Twitter recently that the MOH does have a decent vaccination schedule, as a matter of routine in the non-COVID context, but that we would need to approximately increase that by 10 times to deal with COVID. Is the government able to do that alone? And what space is there for the private sector to jump in and increase capacity?
Yes, I think there's a short-term need and a longer-term need. The short-term need is in the next year or so to vaccinate essentially everyone in Sri Lanka. So we're talking about giving 40 million vaccine doses, and my guess is we only do 3 or 4 million a year normally, and it's the 3-4 million go to kids essentially, they don't go to adults. So I think that there not only has to be a very vastly increased supply, but we need quite different arrangements to reach old people, the men and people like this, and I don't think that can be done through the existing setup, and we can see that even trying to do that is having problems. So we noticed earlier that when the government tried to do mass vaccination, they had to pull staff off other routine work, which also needed to be done. Testing also suffered. So I think that we need to think of more longer term different arrangements, especially if we get into a situation where we have to do booster vaccinations every 2 years, because then we're essentially having to do tens of millions of vaccines on a regular basis. And I think that requires more diverse arrangements. I mean, most countries, if you think about flu vaccination, a lot of it's offered through the private sector. So that's clearly a way of doing that, using GPs in the private sector, pharmacies, etc. I think we're going to have to think that through. And I think at the current time, with the immediate problem, I would say, the government has to buy the vaccines. I mean, I don't think there is actually any supply for the private sector to buy in significant quantities right now. And I think that's going to remain the case for the rest of this year, actually, if you look at the vaccine production data. So I think the government has to buy, but I think the private sector could certainly be used to put jabs into people's arms. I mean, I think I can't see why that can't be done and why it shouldn't be done to reduce the pressure on the existing public services.
Thank you, Dr. Rannan-Eliya. Dr. Lakith, could I ask you to jump in on that? Because so while we have definitely seen across the world, as Dr. Rannan-Eliya mentioned, that vaccine procurement seems to be limited to the government, but other countries have quite successfully delegated the sort of vaccine distribution, actually administering the shots to private hospitals and even pharmacies, and that has resulted in this decentralization of access to vaccines. You can go to the pharmacy at the top of the road and get your vaccine, you schedule it. Even things like when vaccines are getting close to the expiration date, pharmacies are getting on social media and letting people in the area know that they have 20 shots available. If you're in the area, come and get it. And people have been discussing this as a fairly decent system that has been put in place. Does Sri Lanka have the space to do something like this?
Yeah, Anita, I think before we get to the retail level, I think first of all, the government should identify and understand that the private hospitals are ready and standing by to assist the government in COVID-19 vaccine administration efforts. And while we commend the government on whatever the current efforts, We believe that if private hospitals were authorized to act as vaccination centers alongside the existing ones, delivery of COVID-19 vaccination could be expanded. I think that should be the first step that the government should take and the Ministry of Health should realize. And we, as private hospitals, have repeatedly told the MOH and all these stakeholders and decision makers that the private hospitals are ready to help the government in the vaccination drive, but we haven't heard anything positive yet. Sri Lanka has been relatively, a good country in terms of usual vaccination programs. But like Dr. Rannan-Eliya says, that we need to get into top gear and really expand if we are to vaccinate the people of Sri Lanka much faster. And the current process is too slow.
Understood. So a concern that's often raised when the role of the private sector is discussed, especially in something like healthcare, where you're talking about an essential service. And Sathasivam, you also kind of mentioned this when you spoke about how in Germany, about the 50% coverage that the private sector covers actually is also taken care of by medical insurance. Please correct me if I'm wrong, but I don't think Sri Lanka has a very strong medical insurance base for people to fall back on. So when it comes to involving the private sector in this situation, how do we think about the equity angle?
So I think you can take a different approach. I think in England, the NHS is pretty much is engaged with the entire private sector. I wouldn't go as far as saying commandeered, but pretty much engaged with the entire private sector to sort of ensure that all of their capacity was available for COVID treatment. So it could be the same for testing, for example. If the government is willing for all capable private sector to engage in testing to their capacity and that and they're monitored to whatever standards that they need to do, then what all of us as citizens have is the opportunity to get tested, across the board, right? And in multiple locations. So I think it's in that context. Yes, medical insurance is still at a corporate level yet. I don't think it's significantly deep, in the private, and that's also to do with the fact that we've had this free healthcare service. So most, I think, of the population relies on the government healthcare service on a day-to-day basis. So at a crisis like this, where you have new sort of technology coming in, and where the private sector is probably able to scale up quite fast on this particular one, we have to sort of channel them in that direction, which I think is very much possible. Some of it is it's about working with the private sector. So such models exist, and some of this we're seeing happen, but it could scale up significantly. I also agree with Lakith that at this stage, I think private hospitals or private clinics clearly where we can expand. Retail will come a little later, especially I presume the whole booster and all of that when it works through. Any of us who had a flu shot overseas, I've had mine many years ago in a Walmart in Chicago. You showed up, you got it, you moved out. So, and that's the way, where you love for that sort of engagement, where you create more points of access. So I think that's where we sort of see the approach coming through.
So, Mr. Sathasivam, I know that this topic has been touched on before, but we've gotten a question in asking about whether there is a possibility to procure vaccines. I believe Dr. Rannan-Eliya mentioned not really for this year, but going forward, is there a possibility for the private sector to procure vaccines? What is the process, and what are the vaccines that we can expect to enter the Sri Lankan market?
So I think I don't think there's any capacity for private sector to purchase directly from manufacturers. The demand versus supply is at multiple X in terms of what's available. So I think in that way, Dr. Rannan-Eliya said it all in terms of I don't see us till end of Q1 next year being able to procure directly from the large manufacturers. What you are seeing is the second wave of manufacturers coming on board. Right now, the top 3 vaccine manufacturers in the world, GlaxoSmithKline, Merck, and Sanofi Aventis, haven't come on board. So what you're seeing is, there's been new players come on board in the first wave. The second sort of generation of vaccines in terms of the second wave, will be from newer manufacturers who have not yet entered. So you will see capacity coming on board at that stage. Similarly, we'd like to think if, for example, the large players in China, Sinopharm, Sinovac, if they've covered a significant volume in the domestic population, they will have the greater export capacity. So that sort of volume can come onto, but broadly, I would think into the Q3, Q4, end of the year sort of perspective. So that's where I think where the process is. This has a supply chain lag effect of those who made decisive calls 6 months ago have product for the next 6 months. It's just the nature of supply chain, and it will take a couple of more months, but I think it tends to get better. I think in the context of more and more sort of product coming onto the market, from 300 candidates, I think we're down to about 12 to 13 candidates who are at realistic stages, of which you're seeing, Sri Lanka's had only about 3 products come in yet. Yeah, so we've had the Astra, we've had the Sputnik, we've had the Sinopharm come in. We should get Pfizer. Moderna has done significantly in most Western markets. Sinovac is out there. The Johnson & Johnson product is out there. So I think there is more options, but given where we are in the queue per se of orders, we'll have to wait in that context. But I saw good news today. I think GSK is going to fill and finish the Novavax vaccine. So that should increase capacity. So I think the next 3 months will reveal a lot more in capacity that will become available to the rest of the world.
Thank you, Mr. Sathasivam. I'd like to remind our listeners that we are open for questions. So if you would like to speak directly and ask a question of one of the panelists today, you can just request to speak and I'll be able to give you access. Or if you would prefer to just tweet and ask your question through that mode, that's also an option. Dr. Rannan-Eliya, did you want to jump in there?
Yeah, so just to put this into perspective so people understand, because I know people say, oh, they're desperate to get the vaccines and they're asking why can't the private sector buy? To put this in context, there are some very rich countries in the world like Australia, Taiwan, who basically don't think they can vaccinate their populations before the end of this year, right? So these are countries with, economies with very huge purchasing power, and even they cannot get their hands on enough vaccine fast enough. So I think you need to understand in that context, it's very unrealistic that for a developing country, even for the government or the private sector to be able to get vaccines, it's very damaging for pharmaceutical firms in the West to sell vaccines to private buyers when they can't meet the demand from their government clients. So I think that's the context that we're dealing with, and I think that's going to remain the case pretty much this year. So I think the other thing about placing orders, government placed orders relatively late. The countries who did a bit better, and I think Israel is the most obvious example, are countries who placed orders very early and they put cash up front. They didn't just place the order; they handed over the money. And they were often willing to pay above the market price. So those countries ended up getting first in the queue.
Understood. So correct me if I'm wrong, but then what Sri Lanka needs to be focusing on would be just ramping up testing and possibly our contact tracing until we're in a position where we have access to more vaccines.
So whatever the speed of the vaccination, even if you could vaccinate 80% of the population tomorrow, or whether it takes till early next year, which I think what the government has indicated, the reality is we still need to carry on testing. And in fact, I think with these things like the variants, the Delta variant, the problem with the Delta variant that we appear to have now is that most of the vaccines do not have, the efficacy is typically much less than 90%, often as low as 60 or 40%. So we will have transmission. There will be people who are not vaccinated in any situation, so that they will be very susceptible. We need to have a strong test and trace capability for the next 3 or 4 or 5 years till this is over. But in the meantime, at least in the next 12 months, if we want to stop people dying, if we want to stop people having to go into ICUs in the private sector or public sector or whatever, it's great the private sector can do this, provide the services, but what we really need to stop is people needing those services. And to do that, we have to test and trace. That's the only way we can stop transmission. Vaccines are not going to do that this year.
This is a kind of open question to any of the panelists who'd like to jump in. But what we've been saying is, although cases have been rising, the sort of general commentary is that we're not testing enough right now. Especially maybe if we could hear from Dr. Lakith on this. We've seen a lot of policy changes in what criteria you have to meet in order to be eligible for a test. And then this has changed about 3-4 times, I believe, if not more. How has this affected the entire process of testing?
In my view, the government time to time has changed its policy, its strategy, and sometimes we felt that, whether the testing capacity or the testing is even restricted with some of the new guidelines that we have seen. For example, not allowing drive-through PCR testing, then giving, for example, making it mandatory for any person who would want to test themselves to have a prescription in place, restricting walking in people for their own testing. So these are some of the areas that have really restricted the testing. And for example, if I can tell you an example now, before these very recent regulations came in, which restrict the private PCR labs to do more testing. The private sector was doing almost about 16,000 tests per day, with 10 labs being approved by the Ministry of Health and the Epidemiology Unit. However, with the new government regulations, that it just dropped down to half of that. And is that the strategy that we want for Sri Lanka? Needs to be revalidated. So I'm also in the opinion that testing has to be increased. We cannot look at this in a narrow mindset, but we need to understand that it's about testing, tracing, isolating. That will really save the people of Sri Lanka until such time that majority of our people are being vaccinated. It's very important because we also see the mortality rates going up. We see lot of late presentations, and and a lot of people going in for hypoxia, and some are dying. So it's very important for us to be consistent with policy and increase testing and all the precautionary things in place and keep educating the people of Sri Lanka.
So, if Sri Lanka is reducing testing and we don't have enough vaccines, it seems that we're in rather a difficult position. Do we have the hospital capacity, or if we don't have it right now, do we have the ability to expand it rapidly, both in government and private sector, to meet what is unfortunately very likely that we would have a increase in demand there?
Yeah, so what the private sector has done is it was a policy decision by the government, and the private sector acted very fast in setting up intermediate care centers for COVID-19 treatment. And as of now, we have almost 37 intermediate care centers operated by about 15 private hospitals, and together we have increased capacity to cater to about 7,500 patients. Now, this is about COVID treatment. This is about asymptomatic or slightly symptomatic patients with COVID positive. But what needs to be focused is also on ICU capacity increase by the public sector. So in little ways, the private sector can do. We have been able to expand the ICU capacity because we see more and more people needing high dependency care or ICU care. So this is also an area that we need to focus. But the only thing is that no country will be able to expand capacity in terms of infrastructure if we drop our guard. That's the reason why everyone says that it's important for us to test more and more people. It's very important for us to educate so that, we make sure that those behavioral changes are there and all the precautionary methods are being practiced by people. But there will always be limitation in terms of increasing capacity either by the government, the public sector healthcare system, or the private healthcare system. And we cannot depend on increased capacity with more and more people getting infected, but rather we need to prevent people getting infected.
Can I just add something there?
Go ahead, Dr. Rannan-Eliya.
Yes, I mean, I think that the thing to understand here is that the virus spread, if it's spreading, it's exponential, right? So, and what this Delta variant is going to do, it is going to increase the rate of exponential transmission, right? And if our current control measures cannot control the existing B117, they're going to have no chance with Delta. And the problem with exponential spread is that there's no possible way that even the richest healthcare system can keep up with exponential spread. At some point, the system will break. And you could see that even in the United States, which has the richest, best equipped healthcare system in the world, many parts of the United States, in the end, ran out of capacity. And people died sometimes without treatment. So this is the reality. So I really have to agree with Dr. Lakith. The only way we can safeguard the population is to stop transmission. We have to do whatever we can to control the spread of the virus, and the mainstay of that has to be testing, tracing, and isolation. And I'm glad also the private sector they're also contributing to the isolation part, because actually, in some sense, they're providing these intermediate care facilities which keep people away from the rest of the community.
If I could just jump in there, Anita. So the context is also about in a situation as we're in, it's the issue of I think basic economics, right? You focus on what each one is good at. If tertiary care needs to focus on the fact of ICU beds, etc., they should allow a lot more, sharing of expertise in the simpler areas. Whether it's intermediate care, we can really scale that up. And I think if we were approaching it very, very, in baby steps, we should have scaled it better. If you're having capacity issues with PCR, and when we can scale further, but globally, rapid antigen testing has been rolled out again, as it's not as accurate, but it's one more measure we need. So there are good examples out there of how everybody has coped, in cycles. So we need to be more agile in borrowing some of these strategies as we go in, and as we face a more challenging time. We can't, take forever to figure this out. For example, regulatory coordination. If a product is already approved, US FDA, EMA, etc. I mean, we've got to have it immediately available. Typically we could wait a couple of years. In this situation, we can't, right? We need that sort of agility. So we've sort of hit a perfect storm of this, non-agile government sort of meeting a virus that's exponential, right? So you're seeing the results play out. What we need to jump in is, other than just comment from the sidelines, is, offer our services in terms of, here's product out there, let's engage it, let's bring it on board. There will be a learning curve, but I think it comes from trust. I think fundamentally, there has to be trust and mutual respect between the private sector and government. If there are bad examples on either side, but we need to move past that and start working together more aggressively.
Thank you, Mr. Sathasivam. I think we have one question from the audience. Tanana.
Thanks, Anita. I just wanted to ask Dr. Lakith and Shyam, when it comes to, I think one of the main complaints for the private sector is the pricing factor. So when more suppliers join, why the prices still remains as it is, or the pricing factor compared to the other countries. So how do you see it while the pricing of a PCR test compared to other countries? Is there a way that we can bring it down? Is there any tariff or taxes which is involved, which will, I think, embrace the private sector more? That's number one. Number two is, at the pandemic, at the very initial stages, we saw from the government, there's some sort of reluctance or some sort of, I would say, the correct word is suspicion, but because the initial PCR testing was not allowed to done by the private sector, even like COVID patients management, it came at a later stage. So given the nature of the pandemic, it spread so faster, and the couple of days delay could cause an enormous damage. So what are your thoughts on those two things, on the pricing factor as well as the government's initial reactions or reluctance to embrace the private sector on the COVID management?
Thanks. In my view, where the pricing is concerned, I think the private sector also needs to act responsibly to make sure that there is no undue profiteering situation such as this, and make sure that you try your best to bring down prices of some of these essential services and make it available to a larger cross section of people, and that should be our responsibility. And I believe that most of the private players do abide by the regulations of the regulator. For example, even though as of now there is no price ceiling on a PCR test, the 10 labs have been in constant discussion with the Ministry of Health in maintaining a price that is affordable to the majority, both in the corporate sector where they need to do more testing, and it's a regulation by the government to do testing for a percentage of their employees, and also for walk-in patients. So the responsibility is there, and we as an association has been talking to our memberships in making sure that there is no undue benefits that the companies look at a point of a pandemic. And I can give you some examples. When these intermediate care centers were open, the government gave a standard price, a rate that was approved, and all these 37 ICC centers do abide by those price ceilings of the government. So there is certainly needs to have responsibility by the private sector. The second question is about getting the private sector engaged at an early stage. We have seen right throughout, since Sri Lanka is mostly driven by a public healthcare system, what we have seen even in the past is that public healthcare system would roll out a program, and then at a certain point, they do engage with the private sector. So we saw this rightly, like you said, in PCR testing. The government started the PCR testing. This was something new. They wanted to make sure that they do it right, and then rolled out to the private sector and in a more regulated framework. Same with COVID treatment. Earlier, it was only the public sector that were treating COVID patients, but understandably, in a pandemic, we need to make sure that you have mutual trust and you engage a private sector to take a part of the burden out of the public sector, which the public sector has done. So, like Shyam also said, that I think going forward, it's very important that we build mutual trust between the private sector and the state sector, and work together for the benefit of all Sri Lankans. And without that collaboration, without that partnership, without that trust, we will find it very, very difficult to battle against COVID-19.
Yeah, I think from my side, I would only say, open markets competition, has always been, how prices adjust. If there is product available that the regulator approves, and we have more of that product in any form, whether it's multiple PCR products or multiple antigen testing products or vaccines, you're seeing how markets have reacted in that context. So I think what we need to do is create more availability. Right? If internationally there is a lot more product available, we want to make sure more of that product is brought into the market. And when there is more of that availability, prices will adjust. But you're also seeing pricing of innovation. For example, the Pfizer vaccine, which is globally right now, I think probably the lead product, is also much more expensive than the rest. So these are also issues we have to grapple with. We can't pick and choose components of the private sector. We can't have all the efficiencies of private at very low cost of public. You've got to sort of pay up for healthcare as well. When it comes to, but definitely, I think transparency in pricing. The government regulators are there to review that. Look at face masks. From what prices we all used to buy them a year ago to what's available today. Right. This is what happens when there is open competition. Now, quality regulation also has to play a part, because in healthcare, unlike any other product, quality has a far greater sort of impact, especially when it comes to patient treatment. So it's a mix of the two.
Thank you, Dr. Rannan-Eliya. Do you want to weigh in on this?
Yeah, I mean, I think my two colleagues have summarized well what's happened. I mean, I guess the difficulty the government's had is that it's often used to, I would say, ignoring the private sector, and that's fine. For things like polio vaccination, the public sector can do it. But I think one of the weaknesses in the decision making has been that it hasn't been geared to the to the challenge of how you make decisions in an optimal way in an emergency like this. And this is an emergency which nobody in the health ministry has ever experienced, to be fair, right? So if you take the vaccine purchasing issue, which is one example of this, I think there was a tendency in the medical profession to say, no, we need to wait till we have all the evidence and then approve the vaccine, and then we can purchase it, right? But that's not a sensible thing to do, given the risks, given the supply chain problems, given the delays. The sensible countries like the US, like Europe, what they did was they purchased vaccines which didn't even exist. They didn't even have a single clinical trial, but they purchased in advance because they wanted to ensure guarantee. So you have to trade off between secure supply and waiting till everything is absolutely clear and all the data is there before you're making a decision. And that's not always the optimal thing to do. So I think on testing, what happens, I think there was a reluctance to involve the private sector. I won't get into why, but I think in a situation where ramping up testing is the overall national interest, the public interest, I would say, even if there are problems with the private sector, regulatory problems, quality problems, pricing problems, it is better to err on the side of increasing supply and then try to fix the problem instead of saying, I think what has sometimes happened, which is, we'll restrict the supply and because we can't trust the private sector, we can't figure out how to regulate them to achieve this. So I think we have to err here on the side of increasing supply, and we have to take some risks. The policymakers have to be willing to take some risks and to handle things in a more flexible way.
Thank you. So I'd like to ask you, Mr. Sathasivam, another side of the whole pandemic is that the healthcare sector has been focused on COVID-19, and people are would anyway be falling ill. Like, you would have your general medical concerns coming up. How has the private sector been able to deal with meeting demand for everyday sort of medicine procurement and distribution?
So yes, definitely. I think in the context of, because COVID has been front and center, lots of sort of treatment has been pushed to the sides, and also depends on capacity, etc. Especially in markets that have been overwhelmed, you're seeing this, right? Everything else is pushed back. Sri Lanka, so far, we haven't faced that. In that context of, our systems are managing as of now. In that context, what we are finding is, while people have put off elective care, what they choose to do in terms of surgery, etc., we've seen it in waves as well. As the lockdowns have eased, there's a sense of normalcy returns, people trying to get back in there. In terms of product, our concern in terms of making product available, that pharmaceuticals available, has been in the markets that we import from. Are they going through issues? For example, right now, India is going through significant issues. So our concern was, at the start of it, across pharmaceuticals, medical devices, etc., the industry sort of ramped up orders, brought product in. Anticipating, supply chain shortages from those markets that we typically buy a product from. So there will be such shocks. I think there's an element we can do, but there will be some product shocks in that context. But broadly, so far, we've yet to face a significant headwind.
Thank you.
So let me also chip in on this, Anita, if I can. Yeah, even when we take the private hospitals, they continue to provide all healthcare services, including elective surgeries, the laboratory services, dispensing drugs through their pharmacies, which are operated around the clock. I think a crucial role was played by the private sector, and that also catalyzed a wave of digitization to ensure that healthcare was made accessible. And this was despite severe limitations caused by the pandemic. For example, hospitals went into home delivery of drugs. Hospitals went into home lab sample collection, providing home medical care, introducing telemedicine, etc. And also these hospitals, continued to operate under very stringent guidelines and protocols, and made sure that routine access to routine healthcare was given to people, and that is where the private hospitals came in very strong. When the government public healthcare system was mobilized to treat COVID patients, it was the private hospitals that provided access to routine healthcare.
Thank you, Dr. Lakith. We have another question coming in from the audience asking, what is your view or opinion if people are willing to take vaccines from private hospitals if available? What are the factors that people are going to look at? Are they going to be thinking about price and quality? The private sector has started vaccine distribution, I believe, with the Sinopharm vaccine. Is this something we need to be thinking about?
So I think number one is that if the big question is if the vaccines are available in plenty, like I said earlier, private sector can administrate the vaccine, and we have the know-how, the capability of doing that, and also making sure that it is not too much of a burden on the wallet as well. And of course, we are not in the business of importing vaccines, even if it is available out there in the market. That is there for Shyam and his team in pharma. So private hospitals are totally geared to help the government and the people of Sri Lanka in the vaccination drive.
So if I jumped in there, I would, the context would be for example, I think significant corporates, I mean, industries have been willing to fund vaccination for their staff and their families, etc. I think those are the also alternate ways of, funding and as and when product becomes available. I think we should encourage that. For example, the apparel sector or the private healthcare sector or any such export industries feel like it makes sense for them to invest in vaccination of their staff, and I think those should be allowed to happen, right? So you will get a mix of product being procured by the corporate sector, as well as, I presume under some price regulation, they can be available in the private sector as well. And I think we'll have to evolve to that in nature, and not see that as a taboo. The idea that you would pay for your vaccine as long as it's transparent, I think should be, a conversation that's it's out there.
If I can just comment on that last point, I mean, I think there's a difficult problem here, because this is a bit different to say, flu vaccination in rich countries where not everyone gets the flu vaccination, and you can go to a pharmacy or a doctor and pay for it and get it. The problem here is that in order to control this virus, we need to achieve very high levels of vaccination of the population, and we need to maintain it. And that can only be done through a substantial amount of government financing. And so and it's going to be a very heavy cost. I mean, we're already talking about $300 million. I won't do the math into rupees here. But the issue is, the fear I have about the private sector saying, yes, we'll pay for it, we need to make sure it's not done in such a way that it undermines public financing. And remember, one of the reasons the government has delayed buying vaccines is because we don't have enough taxes in the country, right? And the private sector, I know the Chamber of Commerce a couple of years ago said we should increase taxes, but they're not always very consistent in that messaging. So I think, it's good if the private sector is willing to pay directly, but I would hope that the private sector also understands the need to lobby the policymakers to raise overall taxation in the economy, so the government has the money to pay for vaccines for everyone else. Because if we only vaccinate half the population who can afford it and not the other half, then everyone is at risk. Vaccines are not 100% perfect. It's in everyone's interest to ensure that everyone is vaccinated. So I think we need to aim at that. Has to be the goal. And I think it's okay if the private sector contributes, but the private sector also has to have a responsibility that they also need to make the case for increased taxation to pay for.
Thank you, Dr. Rannan-Eliya. I believe we have one more question from the audience. Iranti?
Hi. So this is just a general question. I believe it's actually a follow-up to what Dhananath mentioned earlier, but it's really on the possibility for misallocation and misappropriation when it comes to vaccines. And even when it comes to PCR tests, I believe, if I'm not mistaken, there were some stories on how hospitals were mishandling it, or there were some issues with this. And I was just wondering, because I know that it is in the bigger picture important to prioritize distribution and give hospitals the benefit of the doubt, especially the private sector. But in terms of regulation, I was wondering if the government has the capacity to do anything about this, if the private sector themselves can do anything to just ensure standards, and just how big of an issue it is mishandling PCRs and vaccines.
Thank you, Iranti. Go ahead, Shyam.
Sure. So on the product side, I leave the care side to Lakith. On the product side, I think the context is, Sri Lanka has been a reasonably well-regulated market in product in that context, and we've only had increased regulation in the last couple of years. When it comes to a product like vaccine, yes, it's unusual in the context of universal access, therefore volumes and the experience is new. So yes, there will be hiccups, and there have been, and I think we have to be ready for there will be even more, right, in the context of where it is. But we have to move forward and not get thrown off by a few hiccups that happen, because this is a completely new territory that we're all embarking on, both private and government. And I think mutual trust and sort of a feedback loop, recheck, recorrect, course correct, and move forward. I think that's what we'll have to do. Because if we highlight every error, then everybody gets stuck, right? So then they make no progress. So I would think we should allow latitude for feedback loops, have a conversation, figure it out, move forward. Are there bad eggs in the system? There are. I think but we've got to move beyond it. I think what we're trying to resolve is far greater than that. So we'll have to try new areas, take greater risks, even in disbursement. In that context, is my view.
Yeah,
And also to chip in there, we need to understand that ours healthcare is a regulated industry. And to answer your question, does the government have resources to regulate? Yes, they do have the resources to regulate, because we have been a regulated industry. But just see, I mean, for example, when the pandemic came in, which was very new, I mean, see the amount of agility and the speed at which the private hospitals responded in putting up, safe, high quality healthcare services, which we never knew that we have not experienced. For example, if I let me briefly explain you some of the key measures that the hospitals took, because these are not being discussed, and sometimes it's only the negatives that may come up and will have more publicity. I mean, for example, the moment that we were hit by the pandemic, private hospitals had to provide routine access or access to routine healthcare. But at the same time, we had to keep our staff, the communities that we operate, safe. The virus was unknown. And so the private hospitals came quickly, started something called self-declarations, started digital platforms, so that the risk can be assessed even before a patient would walk into a hospital. They immediately came together and thought that, okay, it's extremely important to triage a person before they walk into a hospital. And they came up with a risk matrix to categorize them. And then quickly observation wards were put up, spacers for resuscitation and nebulization were put up, fitted with HEPA filters. So, I mean, then we came up with, UVC disinfection equipment. So likewise, there is a lot that the private sector has done. And even in the case of PCR, right, totally don't see any lab out of the 10 approved labs deliberately, giving a wrong result or an inaccurate result. Inaccuracy can take place whether it is in the government sector or the private sector. I think as an industry, we are regulated and we focus on self-regulation as well. And during a pandemic, it's very important that mutual trust is being built amongst all stakeholders.
I would just add to that. I mean, I think Shyam mentioned, he mentioned two terms that are very important: the importance of having trust, and also feedback loops. And we need to realize in this situation, whatever the government does, there will be some harm, right? I mean, even if you think about the private sector issues that I think some people are concerned about, there may be problems of bad quality, there may be problems of malfeasance and people doing bad things. Sure, I mean that is there, but we have to balance the harm from those things against the harm, let's say in the case of PCR testing, of not testing enough people. And if we don't test enough people, the harm is much greater. So I think in this kind of emergency situation, the correct public policy position has to be to err away from the side of caution, to take more risk. And then it has to say, well, okay, the private sector, there may be some problems, but then we just have to figure out, if I was in government, we have to figure out how we work with the private sector to address the problems and move on. I don't think we should get stuck in a paralysis of where we can't do anything because we're afraid of some bad things happening. We have to think and keep in mind the much bigger picture, the whole country, the public, their lives and their livelihoods are at stake, and we need to act in the national interest. And I think most importantly, we need everyone, all hands on deck to solve this problem. And that means including, in the case of government, working with the private sector.
Thank you. So I think we have a few more questions coming in. Namini has sent her question via a tweet. I'll just read her question out. So this is on vaccine procurement. Regulators have stated that producers and sellers only deal with governments, but agents are permitted to procure, provided they are authorized by the government. What is the real situation? Can the private sector procure vaccines? I think this is a issue that has been brought up repeatedly during today's conversation. So if we can have a quick response from the speakers.
Yeah, so let me lead with that. In terms of, typically in a process, any product is represented local companies. So, many members of the Sri Lanka Chamber of Pharmaceutical Industry represent all of the global vaccine manufacturers. And then they would go through a regulatory process and either participate in the government tenders, or government procures it, or through the private market. In the space of vaccines, what's happened is the government has stepped in very early in to say that they will be the only ones procuring this product. And, it made sense. That's what was happening globally as well. But I think there was a role in registration, etc., which we could have played as well. At this point in time, given global demand, all manufacturers are swamped with orders, and primarily from governments per se. So that will be their first port of call in terms of supply. What you had heard in the recent have been sort of middle players, who claim to have access of product, because of all sort of supply chain. I guess there will be gaps. There's been context of excess product. And so then there's been excitement of sort of trying if we can get product from elsewhere. That has not played out as a predictable nature, because these require significant cold chain sort of data. We just cannot buy from some random player who claims to have the product. So I think while there was a desperation from all quarters to sort of get it in different ways, I think everybody's come to the realization that the only secure way is through the manufacturers. I think it's been good that whatever was in excess orders across the world is coming back via the COVAX scheme. It's in that context. So I think it will only be through the manufacturers at this point in time.
Thank you. So what will hopefully be our final question for today. We have a question asking, what do you feel about the regulation that is being done currently through the NMRA? Is it effective? Are there better models? Looking at both regulation on medicine as well as medical equipment in the context of the pandemic.
I'll let Dr. Ravi Rannan-Eliya take that.
I think I'll stick to the pandemic situation. I think the NMRA is structured in a reasonable manner to make decisions. I think where I would fault them, but I'm not sure I would necessarily. Maybe that's what I would take my words. I'm not sure I would fault the NMRA, because I think this is a much higher level policy decision. I think we took a very conservative approach, for example, and you could see with some of the vaccine approvals where, they were waiting for lots of data. And that, I think, and then we couldn't make any purchases. And I think that government should either have said, well, we don't really care about the approval, we will still purchase and wait for the approvals later, or they should have been clearer that the review process by the experts should be focused on certain things. So I think we've ended up in a situation, for example, where WHO approved vaccines even before we approved vaccines, even though we were looking at the same data, I think. So I think this is, I'm not sure this is a fault of the NMRA. I think it's probably more, I would say, an inability to adjust to the needs of the moment and to become more flexible. I'll put it that way. I'll leave aside the routine regulatory issues that occur outside the pandemic.
The routine regulatory issues that you speak of would play a role right now as well, if I'm not mistaken, because everyone would need access to that regular medicine and medical equipment.
So I think on that, I think we have a process. I mean, it's based on experts reviewing things. I mean, I think, we have only so much capacity to regulate. So I think I don't have any specific concerns about that. My only real concern in the regulatory space before the pandemic was, I'm not in favor of the kind of price segregation that's been attempted recently. But that's sort of another issue, and I'd rather not go into that discussion.
Yeah, so if I just join the conversation, it will be about the fact that what we need at this point is a lot more, regulatory coordination, especially with what we call reference countries, markets that we have similar sort of policies with. So, for example, I think the UK MHRA, it was a good example in terms of somebody who was leading the world in sort of vaccine, reviews, etc. So, how do we, in a pandemic situation, borrow from those ideas rather than try to, start all over again here? So, I think what we need to do is, I would like the regulator to be more agile in that context, right? We can't replicate in the same way we used to do in the past. We need to move on. We need, if a product is approved by any of our recognized sort of global regulators, we need to make it then immediately available here, right? Those are risks that we probably did not take in the past. We need to move on and take them now, so that newer product is available as soon as we can get access. Because when we come late to the party, there is no product available. I mean, right now we're going to go order these, high flow nasal oxygen meters. We are late in the day. Globally there's so much orders placed. We're jumping in to procure product when it's a bit too late, because in terms of not recognizing where the curve's heading, including in product. So product has to get regulated, but we need to do it at a much faster pace, and also borrow from those relationships we should have with these global regulators.
Yeah, if I could say a quick comment, observation. I mean, this is not just a Sri Lankan problem. This is a global problem in procurement and regulation. And I would just share something that was shared yesterday in the UK. I mean, the UK, there was some material released by Dominic Cummings, the former Prime Ministerial advisor, and he explained, they had to take the procurement of the PPE and the emergency stuff and the vaccines essentially outside the UK Health Ministry, because the UK Health Ministry's kind of regular process, which is probably very good, wasn't flexible or fast enough to react and make decisions in this emergency situation. So this is an emergency situation. We sometimes need to adopt emergency measures, and we need to have a bit more flexibility. And I think we probably suffered a bit from that in the same way.
Thank you. I think we'll start wrapping up now. I'd like to thank everyone for joining today's business discussion, and of course, most importantly, thank our speakers today, Dr. Ravi Rannan-Eliya, Dr. Lakith Peiris, and Mr. Shyam Sathasivam. We've come to some very interesting conclusions, I believe, at the end of this discussion. One of the more pressing questions today has been, how does vaccine procurement work? And I believe the answer that we've received from this conversation today is that it's going to have to be through the government for the next year or so, but then there will hopefully be scope for the private sector to also enter into vaccine procurement in the years to come. And it will probably be required or necessary that the private sector jumps in there, especially if we're going to see a need for things like biannual booster shots, etc. Testing has come out as a priority in terms of immediate solutions to the pandemic, in terms of both making sure we have an understanding of how big of an issue it is we're dealing with right now, and also to handle the problem and reduce the burden on the hospital system. And finally, and arguably most importantly, the question as to what is the role of the private sector here. It seems the private sector has a fairly essential role to play here, and what is crucial is that we have better coordination between the government and the private sector to ensure that we're responding quickly and effectively to the pandemic, that we're having regulation that responds to recent developments that we can see in other countries, as well as, of course, playing an essential role in making sure that we're meeting certain standards with our care. And then finally, to make sure that we start procurement processes early, so that we have access to life-saving products and medicine, and that we get this into Sri Lanka in time. We're able to address this pandemic to the best of our abilities. So on that note, I'd like to thank our speakers again, And of course, thank our listeners for joining in and for engaging with today's discussion. I hope you all have a good night.